There are 1.8 current drug users in the Philippines, or 1.8% of the total population of 100.98 million. Results of the Dangerous Drug Board's latest survey on the drug use situation in the Philippines show. According to the 2015 nationwide survey on the nature and extent of drug abuse in the Philippines, the current drug use prevalence among Filipinos aged 10 to 69 years old is at 2.3%, or an estimated 1.8 million users. Filipinos aged 10 to 69 years old comprise around 75% of the total Philippine population as of 2015. Current drug users refer to individuals who are currently using or have used illegal drugs more than once, from January 1, 2015 until February 5, 2016.
Drug addiction is a chronic disease characterized by drug seeking and use that is compulsive or difficult to control, despite harmful consequences. It is a state of chronic intoxication caused by repeated and improper consumption.
Alcohol enters the body and ends up in the stomach, at which point about 20% is absorbed immediately, and the other 80% is absorbed in the small intestine. The heart then pumps the absorbed alcohol to every part of the body, including the central nervous system, which consists of the brain and spinal cord, and it gets to the brain really fast. So that's why even after just one drink you can feel lightheaded or relaxed. Alcohol acts primarily on the nerve cells within the brain and interferes with communication between nerve cells and all other cells, slowing everything down. And that's why when we drink even a little, we experience the effects of alcohol on our emotions, judgment, balance, memory,
Go. What is tobacco? Tobacco is an agricultural crop that is used to make cigarettes. Its psychoactive ingredient is nicotine and other 4,000 chemicals, 2,000 of which are known to be poisonous and dangerous to our health.
Nicotine, a substance found in cigarettes, causes the blood vessels of the body to constrict, leading to increased blood pressure, referred to as hypertension. Hypertension requires the heart to work. Continued constriction and high blood pressure, the blood vessels become weak and vulnerable to fat buildup. Fat accumulation or atherosclerosis in the walls of the blood vessels can cause obstruction. Smoking also increases coagulability of blood, consequently increasing blood clot formation. All of these effects contribute to the development of cardiac arrhythmia, heart attack, and peripheral vascular disease. Smoking irritates the lining of the lungs, lessening the lungs' ability to fight off infection. It also becomes susceptible to colds, flu, bronchitis, pneumonia, and emphysema. Long-term exposure to smoke also affects elastin, the enzyme responsible for the lungs' flexibility, leaving the smoker prone to emphysema. Decreased oxygen supply deprives the oral cavity from the oxygen and nutrients it needs to stay healthy. Infection can easily penetrate the oral cavity with its weakened health. Smoking causes negative effects to the mouth, such as tooth discoloration, bad breath or halitosis, impaired sense of smell and taste, greater susceptibility to inflammation, and tooth loss. Cigarette smoke contains toxins called carcinogens that trigger the growth of cancer cells. Cancer may develop in any area of the body exposed or even not exposed to the smoke. Once exposed, abnormal thickening of the lining commences, which may later on turn into cancer cells. It can cause cancer in the respiratory system, urinary bladder, and other vital organs. Secondhand smokers are also at risk of health problems. Secondhand smoke is the combination of the smoke coming from the butt of the burning cigarette and the smoke exhaled by the smoker. Secondhand smoking is more dangerous than plain smoking. It contains more toxins, putting secondhand smokers at a greater risk of developing diseases and cancer. With their undeveloped immune system, children are more susceptible to the harmful effects of smoking.
Po ang arestado sa anti-drug operation ng QCPD.
Apat na hinihinalang drug pusher ang patay matapos silang makaengkwentro ang mga operatiba ng Norsagaray PNP sa barangay Minuyan, Norsagaray, Bulacan.
Reports in the use of shabu are growing. Here in Batangas, shabu is said to be the topmost drug used by the residents. And actually, over 90% of Filipinos use this shabu.
Welcome to our third in this series. We're going to cover methamphetamine today. Our bodies were developed over centuries to ingest certain foods, certain plants, certain animals. And the further you get away from that, the more the body freaks out. Methamphetamine is made this way. First of all, pseudoephedrine is extracted from a modern cold remedy. Then, to boost its potency, they add the following ingredients: battery acid, drain cleaner, lantern fuel, and antifreeze. Believe it or not, that is how methamphetamine is made. Now you'll see and understand the effects of it as I go over them. Short-term effects. Meth has the worst short-term effects of any drug I've ever seen. Keep in mind, these effects occur fast. Nausea, bizarre, sometimes violent behavior, hallucinations, panic and psychosis, convulsions, and seizures. Long-term effects: liver damage, kidney damage, infectious disease, depression, brain damage, death. Those are the short-term and long-term effects of methamphetamine.
Substance abuse is marked by period of withdrawal symptoms which can be challenging and hard to handle. Effects or withdrawal symptoms of the use of methamphetamine include restlessness, increased need for sleep, increased cravings for methamphetamines, crippling depression, suicidal ideation, paranoia, and others.
What are the neurotransmitters involved in drug addiction? There are many different chemicals in the brain that function as neurotransmitters. And once drug is taken, the neurotransmitters are also affected. In a precise manner, I will discuss to you the neurotransmitters involved in drug addiction, what it does, and what specific kind of drugs affect it. Number 1, dopamine. It is involved in regulation of movement, reward and punishment, pleasure, and energy. It is affected by cocaine, amphetamines, opiates, marijuana, heroin, and PCP. Epinephrine. It is an excitatory neurotransmitter involved in arousal and awareness. Number 3, norepinephrine. It is also called noradrenaline and a neurotransmitter involved in arousal and alertness, energy, and feelings of pleasure. It is affected mainly by stimulants. Number 4, serotonin. It is involved in regulation of mood and impulsivity. It is affected by alcohol, hallucinogens, stimulants, and antidepressants. Number 5, acetylcholine. It is an inhibitory neurotransmitter involved in movement, memory function, motivation, and sleep. It is affected by PCP and hallucinogens, marijuana, and stimulants. Number 6, GABA or gamma-aminobutyric acid. It is an inhibitory neurotransmitter involved in arousal, judgment, and impulsivity. It is affected by depressant drugs and marijuana. Number 7, glutamate. It is an excitatory neurotransmitter. Number 8, endorphins. These are substances involved in pain relief and reward or punishment. It is affected mainly by opioids and depressants.
Drugs, indeed, are very addictive. It consumes our entire life. It makes us messier. It imposes health hazards. But despite all of these negative things, there are still hope. Despite this darkness, there are still light. And that's the prevention and treatment for drug addiction.
Community-based rehabilitation natin, bigyan natin yung sports development, counseling, yung physical fitness, kasama na yung pagtatayo, zumba, yan, yung approach natin, community services, yun ang binibigay natin para sa kanila. Pero hindi rin naman natin nililimit dahil meron tayong mga drug personalities na nagsipag-surrender na meron naman silang mga permanent job. So yung communication between the barangay members ng BADAC, yung barangay council, doon sa mga surrenders. Ang sa PNP na lang doon is supervisory. Pero nakita natin na hindi talaga siya totally nag-succeed yung community base. Kasi yung sustainability ng project, ng program, yun yung nakita natin dyan. And parang kulang sa kaalaman yung ating mga barangay officials, and parang hindi siya naging priority project ng barangay, which is yun yung ating wino-work out. Kaya ini-involve natin ang other civil society